And so how do we test for these biomarkers? Well, in short, there are two major ways in which biomarkers can be tested. And first, we'll review here is tissue-based testing. And so this includes a multitude of test modalities, from older, less used methods to methods that are still used in clinical practice, but are with the advancement of new technologies, we have different comprehensive biomarker testing on tissue available. And so this will include single gene testing, which is where we're looking for a single gene at a time on a tissue, or that's in the tissue. So this is either by a sequencing modality called Sanger or PCR. And some of now this is less commonly used based on limitations in efficiency, but it still can give us a fast turnaround time in some modalities such as EGFR, or and/or it is cost effective compared to some of our other more extensive testing modalities. This fluorescence in situ hybridization is another modality that is still used in clinical practice, more in the hematologic setting, though it does hold a place in non-small cell lung cancer. It's basically taking two probes, fluorescently labeled probes, so they light up a certain color, and when a fusion is present, you can see the combination of the colors combined that helps to determine whether or not there's a fusion or a rearrangement present. And so this can be quick and highly specific. However, technically, it can be a more complex way of determining whether or not one of these fusions is present. And it requires a lot of high quality tissue in order to efficiently or completely test for accuracy. As I alluded to before, immunohistochemistry is used for protein expression. PD-L1 is a perfect example, as is ALK, or anaplastic large cell kinase, which or lymphoma kinase, which is another method that we can use that's cost effective, but it can use more tissue, and so it may limit modalities of testing that can be done that are more comprehensive and give us a more complete picture of what's going on genetically or molecularly. Next generation sequencing is a simultaneous test where we look at many gene alterations simultaneously or sequentially, depending on the platform. This is looking at DNA and RNA-based sequencing at times. So different structural components from the tumor to determine if one of these alterations that I previously mentioned is present. And so while this testing is some of our most comprehensive and can detect a rare mutation more easily than one other single modality, this leads to a longer turnaround time in order to get that information back, on the order of 3 to 4 weeks at times. And at least the DNA-based next-generation sequencing component at times may miss smaller fusions. And so it's really going into these in more detail. DNA-based sequencing is really, there are multiple kinds of ways to detect or to utilize DNA-based sequencing, which is out of the scope of this presentation. But with the assistance of RNA-based testing, it can certainly improve um, to ensure that we're not missing these fusions and variant alterations that might identify a target that we have for our patients. And so these two modalities really work together in that sometimes DNA-based next generation sequencing can miss some of these finer or smaller indel deletions or deeply intronic or exonic alterations that are actually present. And so these two types of sequencing go hand in hand to improve the detection rate of the molecular sequencing. Um, it reduces, at least with RNA-based sequencing, it helps to reduce some of the challenges that are imposed by longer or technically difficult DNA-based NGS testing or sequencing of the long introns or repetitive introns, which are sequences within the gene that may be more difficult to identify a target.